Dr. Walter Moloi, and I'm a nephrologist at Ketulile Teaching Hospital. So as a nephrologist, I work specifically with patients with kidney diseases, and that includes also the risk factors for kidney diseases. The renal unit is sent to serve or support services in different departments in the hospital. So we'll be actually dealing mainly with patients with kidney disease in the renal unit. However, we'll be also assisting patients also in the ICU, in the theaters, in patients in the surgical wards, patients in the medical wards, and we'll also be getting patients from the general emergency unit who are coming with kidney disease. We are aiming to provide mainly hemodialysis services. We are doing this with the understanding that nephrology or renal medicine is not just about hemodialysis. So at the inception, we are starting with hemodialysis, but the plan in the long term is to introduce other services like peritoneal dialysis, is to also introduce kidney transplantation, which we want it to be a hallmark of what we do in this hospital. There are other services that pertain to nephrology that will be offered in this hospital. This includes treatment for patients with diseases that lead to kidney disease before they develop kidney disease, or those with kidney disease before they go into dialysis, with the plan to help delay progression of kidney disease among those patients. So we can have a transition plan where we plan for patients well in time whom we identify that they are at increased risk of ultimately developing chronic kidney disease requiring dialysis or renal replacement therapy. So those are the services that we envision starting, but we will start initially with the hemodialysis service. Kidney disease are something that is becoming prevalent. It's becoming more common in Botswana, also in the whole world. This is because of increase in the rise of what we call non-communicable diseases. So the main causes of kidney disease are hypertension and diabetes. In our setting, hypertension is the most common cause of kidney disease, followed by diabetes, and it's mainly what you call type 2 diabetes, the type of diabetes that develops in people who are elderly. It used to be very elderly people getting this type of diabetes, but now because of the lifestyle that we have actually adopted as a population, it's starting to affect people from a younger age, which means that we're getting people who are younger who develop kidney disease because of diabetes at a relatively younger age. And the other diseases that can cause kidney disease are diseases that are specific to the kidney, where the different structures or parts of the kidney get sick. We sometimes call them glomerular diseases. That are the third most commonest cause of kidney disease that we encounter in the patients with kidney disease. However, this is a population that for us we think is important because it's the population that we can help to diagnose or identify early with interventions like kidney biopsy, that we can actually then help delay progression to chronic kidney disease. This is a population that if not picked up early, those with glomerular disease, if they're not picked up early, they can easily progress quickly to what we call end-stage kidney disease, requiring to be on this treatment we call kidney replacement therapy. And one of the services that we will intend to offer in this facility is services like kidney biopsy to help pick these patients early and treat them better. Other causes include things like over-the-counter medication that people sometimes are accustomed to taking, things like pain medication, buying it over the counter. Some of this medication can be detrimental to the health of the kidney and ultimately lead to kidney disease. Others include what we call traditional medicine. Traditional medicine, we need to also be very, very careful when we talk about it because it's not all the traditional medicine that causes chronic kidney disease. There is those patients who can come in with chronic kidney disease or kidney disease secondary to the use of traditional medicine. It's very, very important to understand that when you talk about the main causes of kidney disease, we are focusing mainly on the ones that I've just outlined. However, there's other causes of kidney disease, what we call acute kidney disease, where someone is acutely unwell, and because of the acute illness, they develop some form of kidney disease, and those patients benefit from interventions like renal replacement therapy or kidney replacement therapy, whereby we can temporarily support their kidneys while waiting for the kidney to ultimately recover. So the treatments or the services that we'll be offering go beyond just patients with end-stage kidney disease. Will also be patients with acute kidney disease. The kidney is a very important organ in the body. It's positioned in the peritoneal space. It's inside the abdomen, but at the back, just under the last two ribs, if you go to the back. it receives about a quarter of the total blood that circulates in the blood every time the heart beats. And this is a significant proportion. And it serves to detoxify, remove toxins from the body, correct electrolytes, and correct the acidosis of the body. And also produce certain important compounds that help improve how the body functions, improve the bone health, also improve and help the body make blood cells. It's very, very important to now note that because it receives a lot of this blood, it serves to support the body in all of these purposes. It then tells us that it's a very, very important organ in sustaining life. It's important in removing toxins. So it's very, very important that when we practice medicine, we actually put emphasis on trying to avert diseases that may actually affect the kidney. So we've mentioned the diseases that actually are commonly affect the kidney. It's very, very important that if we actually identify the disease, we treat them all in advance, and we help reduce or prevent what you call mortality or morbidity, as kidney disease are among the commonest causes of death in our population. At this inception, we are going to operate with a total of 7 beds, and with these 7 beds, we are hoping that as our numbers increase, we will be able to help about 14 patients a day, and in total we'll be about a total of 28 patients when all these machines are fully operational, when we are doing about 2 shifts in a day. So as the numbers increase, we'll actually end up with a maximum of about 48 patients that will be helping in this unit. So the unit is fully functional with the number of beds that we're studying. We're looking at about 48 patients. However, once it's fully operational with all 14 beds, we'll be looking at this number increasing to about 80 patients being helped in a week in this unit. So the commonest disorder that we'll be seeing specifically in this unit are going to be patients with what you call end-stage kidney disease. So end-stage kidney disease, where those patients actually, the kidneys are no longer functioning enough to sustain the body. So we're looking at diseases that are like hypertension causing end-stage kidney disease, we're looking at diabetes causing end-stage kidney disease, we're looking at other causes of chronic kidney disease. So we're focusing on treating patients with chronic kidney disease. However, it's important to know that the gold standard treatment for this patient is what we call kidney transplantation. So we are aiming to provide this service in Botswana to ensure that the citizens can benefit. Those with end-stage kidney disease can ultimately get the much needed transplantation, whereby someone can donate a kidney to someone who is on dialysis who actually needs assistance with kidney donation. We're also looking into providing what we call peritoneal dialysis, and these are the treatments that are aimed at saving patients with chronic kidney disease. However, it's very important to know that when we look at the whole population of people with kidney disease, those on dialysis make a very small proportion. So we want to focus specifically also on what we call preventative care, where we identify people at risk of developing end-stage kidney disease and then come up with intervention to treat the commonest causes of end-stage kidney disease and to prevent development of chronic kidney disease. Further, those with chronic kidney disease will actually come up with interventional clinic services that will ensure to delay progression of kidney disease, so that we actually keep people off dialysis for as long as possible. Those on dialysis, we work up intervention of switching them from being on dialysis to transplantation. It's very, very important to identify and come up with preventative measures for kidney disease. As we always say, prevention is always better than cure. So it's always very important that we identify the risk factors for kidney disease and prevent to help prevent development of chronic kidney disease. So the key risk factors, as we've alluded earlier, are hypertension and diabetes. These are the commonest risk factors for people that actually cause people to develop chronic kidney disease. So it's very, very important that in our society where there's a high prevalence of hypertension, every adult needs to actually know their blood pressure. If they are identified to be hypertensive, it's important that they be on treatment or they institute measures that actually will help to control or prevent a worsening of that blood pressure. The same applies to diabetes, that if people should know what their blood sugars are, because it helps you to know whether you have diabetes or you don't have diabetes, and the intervention can be brought in earlier. And then between hypertension and diabetes, it's also very important to know that the leading factor or contributor to development of hypertension and diabetes in our society pertains mainly to our lifestyle. So our lifestyle is mainly comprises of being more sedentary. If you look at back in the days, people used to be much more active, and now we are leading what looks like very busy jobs, but we're not really busy. Because we are not busy, we are more sedentary than being active. And the other thing is what contributes mainly to diabetes and hypertension is the diet that we consume. Food is much more prevalent, it's much more now than it used to be in the past. So people tend to overeat, and the amount of food that we eat is more than what the body needs. So because we are eating more, the body now has to deal with the excess that we keep on giving to it, and then that actually then ultimately leads to development of things like high cholesterol, in a way trying to store that excess sugar that the body doesn't really need. And we have to look at things like salt. Salt also is one of the big risk factors for development of hypertension. The consumption of sugary food, and this includes fizzy drinks, includes juices. And there's this very, very, very common misnomer, misunderstanding, especially among people with diabetes who believe that 100% juice is healthier. But you have to understand that consuming 100% juice, you are still consuming a lot of sugar. So it's very, very important that people start considering taking more water than taking juice. After every meal, you must take water rather than taking juice. That helps reduce the load of sugar in the body, which will actually ultimately lead to development of non-communicable disease like hypertension and diabetes. The other disease that unfortunately people cannot do anything about. But what is important is when they develop, people must actually identify them early and present early to the healthcare system. Sometimes there's lack of understanding from the patient side or from the healthcare worker perspective. It's very important, like people who come to the hospital with body swelling, especially swelling of the face, it's always important that we check for the presence of what we call protein in the urine, because that can actually be a first marker or sign that suggests that this person has a kidney disease. So those type of kidney disease, if we can pick them early, we can actually intervene early and prevent progression to chronic kidney disease. There are people who actually, unfortunately, that they have family members who are born with kidney disease, and it's very, very important that if you have a family member who has kidney disease, you ensure that you also know your status of your kidneys. Well, there are certain diseases that can be genetically acquired from parents to children and to fellow siblings. So it's very, very important that if there's a family history of kidney disease, you check yourself early, because it helps you make preventative interventions early, rather than waiting for yourself to get sick before you actually seek intervention. Early presentation helps prevent progression of the disease. So it's very, very important that all those measures are actually entertained in helping prevent kidney disease. So the unit and the hospital at large are coming at an opportune moment whereby there is, as you already alluded, a high prevalence or increasing prevalence of chronic kidney disease. So it will help actually, first of all, serve the population that is already affected. Further, we will also set up interventions that are going to help those with kidney disease prevent progression. And most importantly, we want this hospital to actually be the center for kidney transplantation in this country. So we want that area to actually happen here, because that's something that currently is being done in India. It's not done locally through government. So we think that if we can actually localize this service, it will actually help make a difference and increase the number of people who can benefit from this service. And further, we also want this facility to also be a center where, an academic institution where we'll be able to develop or guide practice of medicine in Botswana through development of guidelines. So we think that guidelines for hypertension, guidelines for treatment of kidney disease will actually be orchestrated from this hospital. So that will actually be a huge contribution to the management, identification of patients with kidney disease, and management of those with kidney disease.